Well, the violent protests and looting in South Africa have led to several COVID-19 vaccination sites in KwaZulu-Natal closing down and a delay in vaccinations. Things have improved, though. I'm now joined by the KwaZulu-Natal Health Department HOD, Dr. Sandile Tshabalala, to tell us about the situation. Doctor, thanks so much for your time. We appreciate it. So, of course, last week there was a halt when it came to people getting vaccinated at certain sites. How are things looking now?
Good evening to your staff and good evening to your watchers of your program. We must report that as a province we were disturbed in some of our sites, definitely, but we are seeing now that we are going back to the normal figures in almost all the sites that we are doing our vaccination in. But we must also report that we were continuing to vaccinate where possible, where people could access, people in terms of staff and people in terms of the people who would want to be vaccinated. So we were continuing, but the numbers are picking up again now.
On average this week, how many people are you able to vaccinate now?
We are aiming to go back and be able to do around about 30,000 people per day, and we think we're going to be doing to be able to do that. Remember that we started this week to do members of the Social Development Department in our province. The SAPS are doing the vaccination, but also we started to register the 35-year-olds and above, and we are continuing to give the first and second doses for the 60-year-olds and the 50-year-olds. So we're hoping that we will reach those numbers as soon as possible.
In terms of receiving vials to vaccinate people, are you getting enough of those?
So far we're getting enough. We did have challenges when we started with the vaccination, particularly in the first phase. We've not had that problem lately. In fact, in some instances, we've had a situation where in 2 days that I visited one site, 2 consecutive days, we would have a few vaccines that would be remaining with people not having come to be vaccinated, and would then call other people who would be around the area to be vaccinated. So we still have enough of the vaccines, and we think if that continues, we definitely will meet our target.
Yeah, that of course is good to hear. But doctor, of course, we are now seeing longer lines because people who couldn't vaccinate last week are now getting into these queues to try to get their jabs. Are you worried about that? Because we're seeing longer waiting periods, the elderly, of course, who are out in the sun, in the cold as well. How are you dealing with that?
Remember that even before we came to this situation we're in now, we already had 7,616 vaccinators that were trained, and we've not started to use all of them. What we then do in sites where numbers increase, we increase the vaccinators so that people stay the shortest possible time, and up to now, we have been realizing that we are meeting that, and we do not think we're going to be exposing people to the cold and all the other weathers that you are talking about. So we are doing that, but also we're opening more sites so that we ensure that people do not stay in one site for a very long time. As we speak, we have about today 191 sites that are working. Before that, we were around 169 sites. So each time the numbers increase, we know how to divert people.
Yeah, I was in Durban on Sunday, and the reason I say that is because I drove past the Moses Mabhida Stadium, which was actually packed, and that's why I asked that question when it comes to people waiting in longer lines, etc. But just in terms of testing for COVID-19, I spoke to the NICD now, and they were talking about a decline in testing given what's happened. How are you seeing a pick in numbers this week compared to last week?
Well, we see that the testing has not been as high as it normally is. The NICD is correct. We also see that the numbers of the positive people are not as high. However, we have given ourselves a 7-day period to view and see whether are the numbers increasing of the people that are testing, but also are the positive numbers increasing. What we have tended to see over the past 7 days is that the positivity rate seems to be going down. I'm saying that considering the 7-day moving average which we use, considering also the incidence risk per 100,000 population. So looking at those figures, we think our numbers are going down. But in the next 7 days, we are going to be having everybody being able to access our facilities and therefore being able to be tested. And we are going again to be reviewing and saying, are our numbers truly going down, or they were going down because people could not have access? Then we'll be able to give a more fair answer than what I'm giving now.
Yeah, and then of course you have the concern of people gathering in large numbers last week during the unrest as well, which could lead to a positivity rate increasing.
You will remember that there was also events that happened in Swaziland, and our province is very close to Swaziland. We are concerned about all such and also other gatherings that are happening when families are having funerals and other gatherings. That is why our principals, our MEC, our premier, and all our mayors and the OSS structures always speak against all those conglomerations and always speak around people adhering to the regulations of COVID-19. That communication is ongoing, on top of which is a demand creation for the vaccination. So that is, we have not stopped to do that, and we think that has also contributed to us seeing the numbers. But as I've said, we are going to wait in the next 7 days and review our standing.
Hospitalizations, how's that number looking, and our facilities coping?
Our facilities are coping. In the province of KwaZulu-Natal, we've got more than 21,000 beds in the public sector, just the public sector. And we have reserved more than 4,900 beds for COVID-19, on top of which we've got more than 800 beds that are in the field hospitals. And of those, up to now, around about 25 to 30% are being utilized. Even the oxygen utilization is not as high as we had expected. So we still are comfortable. We're hoping that we're going to remain in that stance because we do not want to be worse than where we are. The more people don't get sick, it's better. But also we are concerned that there are people who have decided to isolate at home. That is why, as a province, long ago we developed a guide, which guide is guiding people who are isolating at home, but also guiding the carers of those people, so that when people decide to isolate at home, at least they know what to do, and the death rate, therefore, will remain low.
All right, thank you so much for your time and your insight. Appreciate it. KwaZulu-Natal Health Department HOD, Dr. Sandile Tshabalala.